thanks for coming today. And I know what we're talking about, I think. It's mainly you and your teeth and possibly Invisalign. So tell me a little bit about what you're concerned with your teeth. I know a little bit from our email, but tell me some more.
So basically, in the last couple of years, it kind of occurred to me recently when I looked at some pictures from when I was in college. I actually recently graduated from UCSD.
Oh, congratulations.
Thank you. But I was looking at some pictures, and this tooth has always been protruding out just a little bit, but I noticed in the pictures from a couple of years ago that it's become really pronounced, and it's moved kind of significantly in the last 2-3 years, which is understandable for sure, and it's come to the point where I can always feel it every once in a while, kind of clashing against each other, but it's become more frequent. And so I'm starting to wonder if I don't kind of find a way to maybe correct this now, if it's going to be more of an issue in the future. And so I guess that's my main concern. There's some crowding on the bottom and that kind of thing, but mostly I'm concerned about up here and with the crowding on the top.
So mainly concerned with upper crowding, but at some point you're kind of like tripping on that tooth or banging into it. And so that kind of seems weird to you, and then it kind of seems like it's getting worse. Okay. Well, I'm happy to look at that and let you know what my thoughts are. Anything else of concern?
That's mostly it. I'd be all for straighter teeth, but mostly it's kind of like a preventative thing what I'm trying to do, or what finally kind of continuing to trying to find someone to hang out with this.
Okay. All right. Well, we surely, I think, can help with that, and happy to go over that with you. So you know a little bit about Invisalign.
Yeah.
You saw our movie. You know it's removable, and what I really like about it is it's kind of socially acceptable way of straightening your teeth, and I assume that's one of the things that appeal to you.
Yes.
And then I also like it because you can take it in and out of your mouth, and so you can clean your teeth well, you can brush and floss and do all those kind of things, all while your teeth are getting straighter. And then it sounds like to me you're a little bit concerned with the health concern of your teeth not being straight?
Yeah, a little bit. It's just, I guess, if anything, maybe not the health concern, but just like pain aspect of it, or that it could get worse in the future to the point where Invisalign might not be an option. But again, I'm not knowledgeable about that necessarily, so that's my kind of personal assessment.
Okay. Well, what I like to tell patients too when they come in for an Invisalign consultation is that it's not, most people come in to make their teeth look better, and it surely makes your teeth look better, but 50% of what Invisalign does for a patient is it makes them healthier. With your teeth straighter, they're obviously easier to clean. You have less gum problems and less chance of gum disease with your teeth straight. And then when your teeth fit together better, they're more compatible when you chew and you eat, and so you have less tooth wear and less chances of breaking teeth. And so you get a 50% health benefit and 50% in appearance benefit. So either way, you're a winner, and you get a bonus. All right, so what I think I'll do, with your permission, is take a look at your teeth, and then from there I'll be able to give you an idea of how long it will take, and then how difficult it will be, and then from how long and how difficult I can give you an idea of a fee. And we try to give you the best fees we can for Invisalign, and we're pretty good at it because we're the #1 office in the county. So I hope that information will be good for you.
Yeah, no, that's great.
Okay. All right. So let's do that, and we'll do that part next. Okay, Samantha, so I'm going to lean you back, and with your permission, I'm going to stare at you.
Okay, sounds good.
So I'm going to tip you this way, and I just like, perfect, I'd like you to smile, perfect. And then bite down tight. So our upper midline is good. Our lower is 2 millimeters to her left. Perfect. Okay, thanks. We're good. So just hit that pause. so the first picture I'm going to take is your lips relaxed, slightly separated, kind of like this. And then the next picture I'm going to take is a big smile. And open just a little bit as you smile. There you go. Thank you. And relax. Then we're going to do a big smile again. Okay. And perfect. You're doing great with that. Wonderful. You got it? There. You got it? You okay?
Yeah.
Okay, so let's take a look at your pictures. Any questions so far?
No.
No? Okay. Today's already the 19th. So here are your pictures.
All right.
Let me just rotate these. So here's our first picture. Samantha, I take this picture to get an idea where your upper two front teeth sit within your lips. They're the most important teeth in your smile. So I want to make sure I put in my plan that I put them in the right place first before I do anything else. Because once I have them in the right place, I'm going to take your other teeth and put them next to them and so forth and so on until I get all of your upper teeth in the right spot. Because I not only want your teeth to be straight and to fit together, I want them to look their best. And so that's a third dimension to Invisalign that I don't think a lot of other offices think about. But a lot of doctors concentrate on straight teeth and fitting together, but they don't really think about how the teeth fit within the lips so that you have the best smile. And so I think that makes us a little different. So when I look at your upper two front teeth, they're mostly in the right place from a center standpoint. They're a little bit tipped to your right, but they're kind of close. So if I had this tooth and I made it straight, and then I took this tooth and put it next to it when it's straight, and I took this tooth and put it next to it and it's straight, your teeth are going to be in a great position. So when you go to smile, these four teeth will display properly. This tooth is mostly in the right spot. We're going to kind of bring it in a little bit. We maybe want to widen this a little bit, and we maybe want to widen that a little bit so we get a full smile. And you can see a lot of your teeth as you smile. Because when you smile, you display your teeth beautifully. And so if we get them in the right place and arrange them kind of like furniture, you're going to have a beautiful room with a view that fits everything. So I kind of relate those two, furniture and teeth, because you have beautiful teeth and beautiful display. All we have to do is put them in the right spot. Sound good?
Yeah.
Okay. So let's look at your pictures a little bit more to kind of go over more of the intricacies of what we're going to need to do. So there's your smile from the side, and there's your smile from the side. So when we hold everything back, this is what we look at. And one of the things that I want to do is after I get your upper teeth straight, they're going to kind of have a flat plane. And so I'd like to get this plane of your upper teeth. You see how this goes up like this and then out and then down and out? I'd like to get that flat because as I go to make your teeth fit together, if I have a flat plane on the top and a flat plane on the bottom, they're easier to fit together. Okay? And then plus, if you notice this plane is flat, when the teeth are flat, they display and they look nice. So they're easier to fit and they look nice. That makes everything work together really well. So when I look at your lowers, the lower's pretty flat, but the upper has this curve, so we're going to need to work on that. And then when you bite down, there's some teeth that are almost in crossbite here. And so in order to get these teeth lower, I'll draw a little line here. I want to get those upper front teeth down in that area somewhere. I'm going to have to move those lower teeth back. Because right now when you bite down, they touch like this. So I'm going to have to move them back so I can pull these down. That make sense?
Yeah.
So in order to do that, I need to make some room down here, and we're gonna need to do that. And the way we're probably gonna end up doing it is with a little bit of sandpaper between your teeth.
Okay.
So we're gonna kind of thin these teeth, like just the thickness of a fingernail.
Mhm.
And then we can take the teeth and then pull them back, and then pull those down, so we have a nice flat plane here, and a
Okay.
beautiful smile. Okay? So that's kind of our thoughts. And then this is how they touch, and so I want to really make sure I keep a good relationship between your upper teeth and your lower teeth, so you do touch in the front.
Mhm.
Looking at your upper teeth, this gives us an idea how much crowding there is,
Yeah.
meaning the teeth aren't fitting, but this is kind of where I do my work and get that furniture in the right spot.
Okay.
So we need to widen a little bit here, widen a little bit here. That'll give us a little bit more room.
Yeah.
And then also, if we need a little bit of extra room, we'll use some of that sandpaper and thin a little bit. And on the lower, it's the same way, there's some crowding. Plus, I have to move them back a little bit, so we'll do the same thing, we'll widen.
Mhm.
Use a little bit of that sandpaper, pull them back, and then get them all to fit. But this is the picture that means the most to both you and I, and we want it to look its best. So I go back with all the little things that I talked to you about when we're looking at your teeth up close,
Okay.
and then apply them to this picture and see if that works well for you.
Okay.
So what we talked about was widening the smile a little bit here, getting that tooth in, getting these teeth kind of straight across
Mhm.
and upright, and then widening here. And if you imagine those teeth wider and in alignment,
Okay.
I think that would be a beautiful smile. And then when I take those lower teeth and make them fit, you'll have a very healthy smile too.
Okay.
So can you see that?
Yes.
Okay, does it sound good?
Yeah.
Okay, so that's kind of what my plan is. So to do that, it's probably gonna take us about 12 to 14 months.
Okay.
So that puts you in kind of between a level 1 and a level 2 and a level 3 category.
And what
You-
does that mean?
Well, level 1's our easiest case,
Okay.
and level 4 is our hardest case.
Okay.
So you're not the hardest, but you're kind of between the second hardest and the third hardest.
Okay.
So, but for our estimate purposes, Amber, let's put her in a level 2, but for our diagnose purposes, let's put her in a level 3. And what that means, there's a different cost level to each of those levels, so I'm gonna give you the cost of a level 2, but probably your treatment's somewhere near a level 3. So try to save you some money. Okay? So in about 12 to 14 months, your teeth will be straight with Invisalign, and our level 2 treatment is $36.90.
Mhm.
So our level 1's $29.90.
Mhm.
Our level 2 is $700 more than that, so it's
Okay.
$36.90. So that includes all your visits, all your trays,
Mhm.
and at the very end of your treatment, if something's not exactly the way we wanted it and we can
Mhm.
fix it, we're happy to take some more impressions and make some more trays. There's no added cost to you.
Okay.
All right, so we want you to have the smile we talked about. And if at the end of the trays it doesn't happen, we're happy to work on a little bit more at no charge. Okay?
Yeah.
But there's a couple of other charges that aren't included in that.
Mhm.
One is your retainers.
Okay.
You'll need some retainers at the very end,
Okay.
and they run from $400 to $600.
Okay.
And then the other is your records at the very beginning.
Okay.
The records are x-rays, these pictures,
Mhm.
a full exam of your teeth with those x-rays, and then I need to take a three-dimensional model of your upper teeth,
Mhm.
a three-dimensional model of your lower teeth,
Okay.
and then that gets CAT scanned.
All right.
So that's probably the most complicated part of it. And then I'll have your teeth on a computer.
Okay.
And then on that computer, I move your teeth to where I want them,
Mhm.
and I send that record to Invisalign, and they make me the trays to get you there.
Okay.
All right? So the record runs $495. And then the retainers run from $400 to $600.
Mhm.
And then the Invisalign treatment is $36.90.
Okay.
So somewhere around $4,100, $4,200 for your records and your Invisalign treatment, you can get started with Invisalign.
Okay. Is there a chance that I can get all of those costs written out for me before I leave today? I'm trying
You-
to like solidify them in my mind as you're telling them to me.
Absolutely. I like to explain them myself, but as we speak, Amber's writing this all down, and
Okay.
she's gonna have it all down in there.
Thank
So
you.
I don't mean to scare you with all this. but we're gonna give you a written estimate, absolutely, for sure. So, does that leave you with any questions?
So there's enough space for everything? I guess something that I was wondering is if anything needed to be like removed to make room for like any of the teeth or anything like that.
Okay, well, good question, but I am very much a proponent of minimally invasive dentistry.
Okay.
And that means I very seldom, and I hate to take any teeth out.
Okay.
And in your instance, my estimation is that we won't have to.
Alright.
We will need to be using that sandpaper
Mhm.
to get them to fit, but I love the fullness of your smile, I love the size of your smile, and I love people when they smile to show their teeth.
Mhm.
And when teeth are extracted, things get shrunken back,
Okay.
and you lose kind of the view of the teeth, and the smile looks smaller.
Mhm.
And so, for two reasons. One is for being conservative and not wanting to take teeth out unnecessarily, and the other is to make your smile better. I don't want to take any teeth out.
Okay.
All right, but that's a very good question. Anything else?
Oh, so you say sandpapering the teeth,
Mhm.
does that do, it just makes it smaller? Are there any like concerns about like wearing down the teeth with like the sandpapering and making them, you know, a little easier?
Well, good question again. The sandpaper takes out a small amount of enamel, and yes, there is some enamel that is taken away. But you have about 3 thicknesses or 4 thicknesses of fingernail on each of the teeth that we were planning to sandpaper. And we're taking half of a fingernail on one tooth and half of a fingernail on the other tooth, so to speak. So there's quite a bit of enamel left. And then all of the studies that we have with what we call IPR, and that's what the sandpapering is, shows that the teeth do not become sensitive, they don't become more decay prone, and there's really no harm to the tooth. But taking a little bit of enamel away on, 5 or 6 teeth, in my opinion, is better than taking a tooth out, or in a lot of instances, taking 4 teeth out. So it's a lot more conservative, and we know long-term it doesn't cause you any harm.
Okay. Yeah,
All right, but good question, good question. Anything else?
No, nothing I can think of.
Okay.
But the bite's okay?
Well, the bite is difficult. It's a little
Okay.
tricky. You have what we call a class 3 bite.
Yeah, you mentioned that.
Yeah, and what we're going to do is, this molar is really forward, what we're going to do is try to bring those teeth back and these teeth over without extracting any teeth.
Okay.
Now, will your bite be absolutely perfect when we're done? No. Moving this molar, really the only way to get that relationship right would be to do jaw surgery. And I'm not sure you want that, but it is an option if you like. And it's not going to be an exact textbook bite, but it's surely going to be a better bite than what you have.
Yeah.
And so that's what I would tell you in terms of your bite. Okay? Anything else? Okay. There's one more thing I want to show you before you leave, and that is our Invisalign trays. This is what the trays look like. It hasn't been in anybody's mouth. I do have trays, I don't know if you noticed.
Oh, okay. Alright.
And then if you notice, there's little bumps on the side of these trays.
Okay.
And what those bumps are, Invisalign calls them attachments, we call them buttons.
Okay.
But this is what a button looks like on a tooth. They're tooth-colored buttons. See that there? And people have anywhere from 4 to 10 of these in their mouth.
Okay.
And what it helps do is it helps rotate teeth, and then it also helps hold the tray tighter against your teeth so that all of the teeth move more accurately. And so I just like patients to know that, because more than likely, there's been a few that haven't had any buttons, but more than likely you're going to have some buttons. And you feel them, but most people don't see them, in the social distance. Okay. So any other questions?
No, I think that's it.
Okay, well, Amber's all ready with her estimate, and we'd love to have you as a patient.
Okay. No, this
And-
is a great experience.
Okay, good. But thanks very much for coming in. Hope to see you back.
thank
Okay, bye-bye.